We are Mr. and Mrs. Samuel Kangere Kimani from Kenya, Nairobi, and one Sunday my husband was having headache, and it was quite severe. He had an aneurysm, and he had to be operated. Communicating through the email, we arranged with Mr. Ramesh how we can come. He wrote to us a letter which speedily speeded our visa, which we got in hours. It was done in hours, in fact. And then the air ticketing. And when we arrived, we were received by the international people from Fortis Hospital, and which was very good. Urgently, we were rushed to the hospital, admitted, and the doctors immediately took over to treat Mr. Samuel.
Samuel, the patient, had come to us from Kenya. He had severe throbbing headaches with double vision, and that lasted for a few months. Investigations showed a very large wide-necked aneurysm of the left internal carotid artery. So an aneurysm is something like a balloon dilatation of the artery, and because of the continuous pulsation of that aneurysm, he had double vision. It was affecting the nerves to his eyes. We first did an angiography to confirm the diagnosis, and then we did something new called a flow diverter insertion. And the flow diverter is something which remodels the artery in such a way that once you put the flow diverter, the aneurysm over the period of 2 to 3 months will gradually disappear, and then the patient's artery will become normal. So we did it somewhere in the middle of June, and within a few days itself the patient's visual symptoms became better and his headaches became much better.
I've seen a very good improvement. When we received, I had quite a bit of severe headaches and I couldn't see properly. I think before I was admitted at Nairobi Hospital, the headache was tremendous. I mean, I've never had such kind of headache. And right now, I can say that since that procedure was done, I've never even had to take any painkiller.
And also when we got in touch now to the doctors in Fortis Hospital, they were swift and very kind. Up to the last minute yesterday, we went to see Dr. Banerjee, and he was wonderful. The nurses were kind, 100%.
So we are hoping to have a repeat MRI for him in probably next month, and that should show that the aneurysm has completely disappeared.
Made it possible for us to be in India, in Fortis Hospital, and in fact he was the one holding us up till when he handed over us to the doctor in Bombay. With the connection with the international office, I think that is where they get the 100 mark. And we thank them very much. We'll continue to recommend to them to anybody who would want, nobody wishes another one sick, but in case we have friends and we have people who would want good and kind treatment and kind handling, we will recommend them anytime, anywhere, any place.